It is time for our weekly segment, Patel It Like It Is, where ABC News contributor Dr. Alok Patel shares health advice on the topics that matter most to you. And today he is answering some of your questions. Dr. Patel, I want to start first with this new report on measles, because the World Health Organization says cases are surging worldwide, infecting 10.3 million people just in 2023. So what should people know?
Well, here's a couple other numbers people should know, Diane, is that in 2023, there were about 107,000 deaths from the measles, mostly in children under the age of 5. And that number of cases is up 20% from 2022. And across the world, 22 million children missed their first dose of the MMR vaccine, which can prevent all of this. So measles is a virus, but some children who get it can be left with permanent disabilities, such as blindness, severe respiratory infections, swelling from the brain. And we have a huge issue with those vaccination rates dropping, not only because of access, but because of misinformation, people getting the wrong information. So the measles vaccine, safe, effective, make sure your children are covered. This should not be a headline.
An anonymous viewer in Texas also writes, how are rules changing about getting emergency contraception pills? What about abortion pills by mail?
It's a lot to talk about here, and I respect this question because it really differs per state. What I want to say is that there's a difference between these two pills. The emergency contraception is really referring to either Plan B or a copper IUD, which are highly effective at preventing pregnancy if taken soon after sex. The book says 120 hours, but it's best if you take it right away. Now, these are currently legal in all 50 states, but it may vary depending on how you're able to access it. Over the counter, a pharmacy, a pharmacist needing to approve it. In some states, a pharmacy can actually deny it. Now, abortion, medical abortion, such as that pill, now that is usually taken in the first trimester. It's what's called the medication abortion. It's actually the majority of abortions in the United States are done by taking this pill, which is usually a combination of two. Now, what's important to note is that even though there are abortion bans in a few states, people are actually able to access this via telehealth thanks to SHIELD laws. But it really does depend on your state. And for people out there who don't know their laws or maybe afraid to talk to a healthcare professional, I'm sorry that reality exists because it can be confusing, it can be scary, but there is legal help that people can get by going online to reproductive legal hotlines so you can better understand your options in the state you live to make the right decision for you.
And Ben in Seattle, Dr. Patel, writes, why is it we can only sign up for health insurance once a year? Why not all the time?
Ben, I feel you, because a lot of people wonder, like, what is this small open enrollment window? Now, depending on your employer or the healthcare marketplace, there is a small time frame where they want you to enroll. And this is likely to make sure that there's a steady pool of premiums being paid and a mix of people who may have pre-existing conditions or those who don't. So for people out there, make sure that if you get a new job, you are looking at that window when to sign up. And for the open marketplace, healthcare.gov. That window opened November 1st and it closes January 15th for February 1st coverage. Now, one important thing to note that on healthcare.gov, every single plan, according to the Affordable Care Act, must cover essential health benefits, free preventative care, and cover you regardless if you have pre-existing conditions. So sign up today if you don't have health insurance.
And lastly, a new study that analyzed data from the National Health and Nutrition Examination Survey found beer drinkers may have worse diets and liver health compared to wine or liquor drinkers. Why is that? What's your reaction to this study?
You know, all alcohol is probably not great for your diet, and it's all terrible for your liver. Now, Diane, this is one shot in time looking at 1,900 adult alcohol consumers. They looked at people who just drink beer, wine, liquor, or a mix of all of it, and found that beer drinkers were most likely to have poor diets, an increased risk of liver disease, and were more likely to smoke. So like I said, this is just one snapshot in time, but it just goes to show you that how much all of this plays in to your liver health. So alcohol in moderation, make sure you're eating a healthy diet, move, and take it easy every now and then. Your brain, your heart, and your liver will thank you.
All right, Dr. Alok Patel, thank you. And if you have questions for Dr. Patel, just leave him a message on our Instagram feed. He might answer your question right here on Friday.